Hi, this is Leah and Susan. We're friends, classmates, and students together, and we are going to do physical assessments on each other and going over general appearance, skin, HEENT, cardiovascular, and pulmonary. She is the patient. So first, I'm going to assess Susan's general appearance. She has no body odor. Her skin is warm, pink, and dry. Her face is symmetrical. She doesn't have any drooping. She appears to have good hygiene. She doesn't have any marked lesions or anything on her face. So assessing her skin throughout the whole assessment. She has warm pink dry skin, no lesions over here. Susan, do you have any recent scars or tattoos?
I do not.
Okay. And have you had any wounds that haven't healed?
Nope.
Have you had surgery recently?
No.
All right. So, moving on to her HEENT, her head. As I said before, it is symmetrical. She doesn't have any drooping. Going to ask her level of consciousness is she's awake, alert, and oriented. Her speech is intact. Her speech is clear. It is organized. It is spontaneous. And I'm going to look at her eyes now. I'm going to shine this light in both your eyes twice. Do you have any glasses that you wear?
Nope.
Not for reading?
No contacts, no. Okay. Nothing.
And have you had any changes in your hearing or vision lately?
Nope.
Okay. We're checking for perla here so that the pupils are equal, round, reactive to light, and accommodating. And they are. And Susan, can you look at this pen light and then look back at the wall? And back at the pen light. All right. And then HEE, ears. We're going to check her ears. She doesn't have any drainage or any problems in her hearing. Her ears are symmetrical. There's no scars or lesions. Sorry. Her nose. Are you having any drainage or anything going on in your nose?
No. Shouldn't.
Okay. Nothing. No congestion. All right. And her mouth. Can you open your mouth and say ah? And her mouth is warm. Well, I think it's warm. It's pink and it's moist. Her nose was also moist and pink. There was no drainage, no lesions in her mouth. She's not missing any teeth. She doesn't have any dental appliances. And she has no cavities or anything. And then moving on to the cardiovascular. We're going to listen to her heart. I'm going to listen in 4 places of her heart. Her aortic, pulmonic, tricuspid, and mitral valve. And that's where I'm going to listen to the apical pulse for 1 minute. And those are the 4 landmarks. And that's on the right sternal border, second intercostal space, left sternal border, second intercostal space, fourth intercostal space, fifth intercostal space, mid-clavicular line on the left sternal. Left. And then I'm listening on the 4th spot, the mitral valve, with the apical pulse for 1 minute. And 1 minute later, her heart is regular, strong, and doesn't have any dysrhythmias or irregular heartbeats. And it is equal. Listening to her pulmonary now. We're going to listen to up here, the inner 1/3 of the clavicle, the second intercostal space, fourth intercostal space, and the sixth intercostal space. And then we'll listen to the back in just a minute. So each time I move my stethoscope, go ahead and take a deep breath for me. We're comparing left to right. Okay, and on the posterior side, her lungs are equal, clear bilaterally. There's no crackles, nothing, no wheezes, no abnormalities. And that's in all lobes. Now I'll listen to her back side, and I'll listen to above T1, above the or at T1 above the scapula, and then at T3. Can you turn around for me? Thanks. At T1 above the scapula, at T3, in between the vertebral column and the scapula. We skip T5 and we go to T7 at the base of the scapula, and we listen to T9 outside more, and T9 at the axillary, post-axillary line. Again, comparing left to right. All right, and I did not hear any wheezes or crackles. Her lobes were clear bilaterally, and her breathing is unlabored. Her respirations are regular, and her lung sounds are clear. So, thank you, Susan Matthews.
Thank you.